A new drug is helping stop the spread of malignant melanoma. Recent studies found the drug seeks out and blocks a mutated gene found in patients. Researchers say in cases where the gene is present, the tumor shrank 70% of the time. Dr. Alan Magaziner from the Magaziner Center for Wellness is joining me now. This is kind of exciting news.
It's very exciting because malignant melanoma is one of the most virulent and difficult skin cancers to treat, unfortunately. And it's been a rise over the last 30 years. It's gone up actually fourfold. So in research right now, we're finding out that this particular medication may actually block the genetic predisposition or the genetic mutation for malignant melanoma. It is currently in research right now, and they're going to be running some clinical trials, so we'll have to look forward to see if this really does what we hope it does in patients.
What's typically the timeline when you have these clinical trials before it might get to the market?
Difficult to say. It could be at least 3 years sometimes, so there's still a lot ahead of us. It is available only in clinical trials right now in London.
Okay, let's move on to this other story today. The Surgeon General wants to ease restrictions on moms who breastfeed, basically requiring employers to make it easier.
Much easier, hopefully. I mean, they're trying to remove the obstacles. We're trying to encourage moms to breastfeed right now for at least, if they can, up to 6 months. In fact, right now only about 13% of the moms are breastfeeding as much as 6 months, and they're trying to encourage women to do it. They're trying to get the numbers up to about 25%. So what we're seeing now is that the employers are going to be offering like a private room for moms to help pump during the workday. And I think it's a great idea because it should make them much more healthier, because what's going to happen now is they'll be able to work more hours because the babies at home will be healthier, hopefully, because they're being fed the breast milk.
Recently, there have been some controversial studies about this, or conflicting studies, I should say, about how long a woman should breastfeed. So how long should they, and what are the benefits of breastfeeding?
Well, the benefits we know are the baby is much less prone to infections, first of all, because of the immunoglobulins that is transported from the mom. So less ear infections, less asthma, less pneumonia, less diarrhea. It's wonderful. How long? As long as you can.
Okay.
The Pediatric Association recommends try to do at least 6 months and possibly even up to a year if you can, or even longer.
Okay. And then moving on, a new study today in neurology found a rise in the number of stroke patients with HIV. What's happening here?
Well, the overall stroke rate has actually gone down over the last 10 years, but what we've seen is that there's an increase in stroke in people who have HIV. We're not sure why, but the rate is probably up to 60% increase over the years. We think it's one of two reasons. Either it's due to the actual medications that people are placed on to treat the HIV, and there's so many more antiviral agents now, we're using multiple agents to help treat the condition. So number one, it may be the actual medications, or it may be the actual virus itself. People are surviving longer, and the actual virus may be imparting some inflammatory, what's called cytokines, or substances in our body that may be contributing to stroke.
Right, and inflammation is the root to heart disease and stroke and so many other things.
That's
so if you have inflammation, that's the trouble spot right there.
That's right. So we need to try to decipher what is it. Is it the actual disease itself, or is it the medications? And we'll have to do some more research to figure that out.
All right, Dr. Alan Magaziner, thanks for coming in.
Thank you for having me.
Appreciate it.
Thank you.
We'll be right back.